patients with chronic illnesses make decisions on a daily basis by weighing up the benefits or the risks to them. One example, I went to a party on Saturday, and in my head, I really wanted a new dress because I thought I'd look terrible if I wore anything that I already owned. It's a girl thing. And I sat there on Saturday morning deliberating about whether to go into town and buy a new dress. In the end, I didn't, because I knew if I'd gone into town and gone shopping, I would have been so exhausted, I wouldn't have been able to go to the party. So you can see a really simple decision actually becomes this kind of internal dialogue. And when you think about something like adherence, you can see how that would as well become a daily weigh up of the benefits and the risks involved. So we're going to look now at the practical, physical and psychological barriers to adherence for patients. So I'm going to start with practical. The quotes that you'll see on these slides are from a variety of different CF patients who've contributed. So the first big barrier in terms of practicalities is time. If you're working full-time or short-term, full-time or part-time, or maintaining a family or social life, your time is really precious, and a lot of treatments that people with CF follow can be big time users. For example, the nebulizers I'm on include an hour and a half in the morning, an hour and a half in the evening, and you can see if you're trying to get into the office for 9 o'clock, that can be a struggle, and you can also miss out on some social events in the evenings because you need to get home to do that treatment. Noise is a big issue. If you have chronic illness, you quite often don't want people to know about it. You want to fit in with the crowd. And if you're going away or going somewhere where you have to take noisy equipment, like the physiotherapy vest that we use sometimes, that can really draw attention to yourself. Access also is a practical issue. It's just additional stress if you're running around trying to find a pharmacy that actually stocks a specific drug, or if you're coming home with months' worth of supplies of a drug that's really bulky. It's just another thing to think about. So physical. With this, obviously, the big one is side effects, and these can be immediate or long-term. With short-term effects, like from some antibiotics like ciprofloxacin, effects like dizziness, nausea, upset stomachs can basically mean that if you think you've got something big coming up, like a massive presentation, you might cut out taking that for a few days in advance because you don't want those effects to crop up at the wrong time. Longer-term effects like osteoporosis or late-effect psychological problems can also make you think really hard, actually, about whether you would even take a specific drug at all. If you can see in a few years down the line you might be suffering from that, although it might be prescribed by your doctor, there's a big chance that you won't be taking it. And when we think about side effects, I think we also need to think about the cumulative effect of a regime that someone with a chronic illness will face. So when you're looking at a drug, prescribing a drug, or just coming up with a drug, don't you think about that one in isolation. Think about the person who's going to be taking it, and think about the other drugs, but also the regimes and physiotherapy and exercise that that person's going to be doing, and where yours fits into that, because there's going to be loads of other side effects in play during that person's week or month or year. And then the final set of barriers are psychological. Now, I know these vary a lot between individuals, so I'm not trying to speak for everyone here, but there are a few key themes with psychological barriers that do crop up. The first one is a reminder that you're ill. Basically, being a person with CF and taking a lot of treatments on a daily basis is essentially a reminder that you do have an incurable disease and it's going to kill you. And that's not necessarily something you want to be thinking about regularly. So sometimes giving yourself a break from that can be a really positive thing. Medicalisation is another psychological barrier. If you've been prescribed food supplements, for example, you might feel like something that you're meant to enjoy, like eating, has actually become a form of treatment, and you might want to avoid taking those supplements. And the last psychological barrier is control. If your doctors have prescribed you a huge amount of drugs to take, you might feel like giving yourself a day off from everything, or a week or a month off of a specific drug, just to reassert that control over your life and over your time, which you think should be your own. So as I said, patients do weigh up the risks and benefits involved with adherence on a daily basis, and sometimes the risks actually come out on top. So non-adherence wins the day. That's not to say there aren't benefits to adherence, and I think most patients are aware of that. Obviously, physically, the benefit is a long-term improved health prognosis, but there's also psychological benefits, such as appeasing your doctors, appeasing your friends and family who are keeping an eye on you. Adhering to drugs can also give you a sense of routine or a sense of normality, which is beneficial. So I think the key is we can't do an awful lot about improving the benefits of adherence, because that's what the drugs are there for, but what we can work on is removing the barriers to adherence. So we're just going to look at how we might break down some of those barriers now. So practical recommendations, the key one again is time. How can we make things quicker? Well, we're talking about quicker to prepare and quicker to deliver here. For example, intravenous antibiotics for home use that are delivered pre-mixed, pre-drawn, and in self-delivering pods, so you don't have to faff around at 4:30 in the morning trying to draw up some injections. Drugs that require fewer doses. I've just been put onto a vitamin D booster that I only have to take once a week rather than every day, so that's a really big step forward. And also equipment which is quicker to clean. Again, I've just been put onto a tobramycin porthaler instead of using a nebulizer that has to be cleaned in between each dose, and I use that 6 times a day at the moment, so that's a lot of cleaning that has to be done. Practical recommendations again for drugs and technology, just to be quieter and easier to transport around if you're going away, and easier to obtain and to store. So preferably ones that don't need to be kept refrigerated the whole time, so you can take them away for a weekend, and just reducing that additional stress. So physical recommendations, again, is all about side effects. So just to think about the immediate and the short-term side effects of the drugs that are being prescribed. And as I said before, just consider the whole regime that your patients are on and where yours fits into that. Some patients with CF have said that they see going into hospital for IVs as a 2-week holiday because they feel the regime of drugs and the side effects that they're constantly on at home is such a burden that they see going into hospital as a break. And I think anything we can do to get away from that is really beneficial. And then the recommendations for psychological improvement. The first one is removing the stigma of non-adherence. And I know a lot of you guys are probably doing that already, just having that dialogue with patients so they don't feel they have to lie and say, oh, I am taking that every day. And removing the stigma means that your statistics will be more reliable and more accurate, and you won't be seen as to be failing if people aren't taking them. The second is to remove the medicalisation wherever possible. So this comes back to the food supplements. If you are coming up with food supplements, then try and make them look and smell as much like normal food, whether that's a yogurt or an energy drink, as possible. I know you can't do much about the taste, that's fine, but at least if they look there in the fridge at work, people will think there's something normal and not ask, why are you taking that? That looks a bit funny. And just really to educate as well. Patients with chronic illnesses often want to find out as much as possible about their illness, about the drugs they're taking. And if you can be really upfront with doctors and directly to patients themselves about the risks and benefits of a certain drug, you'll find that they're much more well-informed and find it more easier to make those decisions about adherence on a daily basis.